Good evening, everyone. I apologize for the delay. I was in a bad service area. However, I'm here, and I'm excited. I'm so excited to share this information with you all this evening. I'm very excited for our special guest to come on and give you all so much value. I asked one of the questions in the Facebook group, which is our Facebook group here, support group for primary caregivers. One of the questions that I posted was, how do you know if your loved one is eligible for Medicare and Medicaid? And a lot of you all responded and wanted to get more information in regards to those two benefits. So I'm very excited to share that information with you because Miss Samaria Carr is an expert in that area. I am not, even though I have worked with a lot of families in regards to Medicaid waiver programs, which I'm excited because I'm going to bring some additional information to you all very soon about a new Medicaid waiver program for those seniors who are wanting to stay in the home, and for those primary caregivers who are taking care of their loved one full time. There's some other Medicaid waiver programs available for you all, so I'm super excited about that information as well. But back to tonight, we are going to share, me and Miss Samaria is going to share a lot of the information on how to know if your senior or if any senior is eligible for Medicare and Medicaid, know what the difference is, and some of the new regulations and guidelines that they have put out this year in reference to seniors qualifying for Medicare and Medicaid. So let me introduce myself. Some of you might know me, some of you may not know me, but I am the founder of this group, support group for primary caregivers. And I started this group because I am a senior care transition specialist, and I have worked with a lot of families and their loved ones. If they're whether their loved ones is their mom, their dad, their aunt, their grandparents, their husband, or their spouse, I have worked with a lot of families who have loved ones that are needing assistance with activities of daily living. Okay, and when I say activities of daily living, that's needing assistance with personal care. So maybe bathing. Sometimes they become incontinent due to a disease. For example, a stroke. One of the aftermaths of a stroke can cause incontinence. And as they just age, sometimes it causes incontinence. So those are personal care needs that a lot of times seniors or a loved one might need assistance with due to aging or disease. And then you have companionship or assistance such as meal preparation. They're no longer able to cook for themselves. Mom or dad keeps forgetting to turn off the stove. You know, things like that. So there are services out there that can allow your loved one to recover or age gracefully in their home, or if they're needing additional care such as 24-hour care. Maybe right now mom and dad is needing 4 hours a day, 5 hours a day, 3 times a week, or 4 to 8 hours a day. Hey Paola, 5 times a week. But then they might need to transition into assisted living, where you might live long distance and mom and dad has no family in another state, and to give you peace of mind knowing that they need to transition to assisted living or a smaller assisted living type setting such as personal care home. But I'm not getting into all of that because that's what we're talking about tonight. But I just wanted to share with you all why I started this group, is so that I can explain these different resources to you, different types of care, and just encourage, support, and put a group together where you don't feel like that you're alone, because you're not alone. I've had so many calls and with wives or husbands or grandchildren or daughter, son, not knowing anything about what to do for their loved one, don't know where to start, don't know who to talk to. And it does not have to be that way. There's people here, such as myself, that can help you through that process, that can help you, here to encourage you. And there's people in a group that has already been through what you've been through, and they can help you as well. So that's what this group is all about: encouraging, uplifting, providing resources, and educating you all on what you need to know when it comes to our seniors, because the population is huge. Baby boomers, I put the years on in this group. I don't remember the years exactly off the top of my head, but I'm like, wow, my mom is a baby boomer. My mom is in the range of the year of baby boomers, right? So soon, my mom might need assistance, right? So we all are here to help each other. So I'm not going to keep going on about that. I want to bring on Miss Samaria Carr, who's going to talk to you all about Medicare and Medicaid. So let me go ahead and request her. Well, she's already requested me. Yes! She got it down now.
Hi, Rebecca.
Hi, how are you?
I'm beautiful, thank you. How are you?
I am great. I'm so excited. Like I told you earlier before we got on this live, I'm so excited with the information that you're about to give to the group, the value that you're going to add. So I recommend that you all have pencil and paper to take down some notes, because she's going to give you a lot of information. And then if you would like to move forward with additional information, or you have those additional questions, she offers free consultations over the phone to help you through that process, or any of those questions that you might have. Okay.
Right.
So tonight we're talking about, how do we know if a senior qualifies or is eligible for Medicare and Medicaid?
Yes.
And first off, she's going to start off by explaining what the difference is between the two, correct?
Right. Most people confuse Medicare and Medicaid. Well, first, Rebecca, I do want to just acknowledge you and tell you how much I appreciate your dedication to serving our seniors. Truly, seeing you push and go, and the heart that you have for our seniors, it really inspires and motivates me to keep doing the same. So I really want to give you your flowers for that, because I appreciate you. Like, we sit back watching, you were just everything. So I want to make sure you understand, that.
Awesome. Well, thank you. It's my
You're
heart to
welcome.
serve. And before you get started, I'm gonna ask you, can you raise your, because we can't see your entire face.
Oh yeah,
There. That's
okay.
perfect.
Okay, no problem. I thought it was because of our split screen, but so we are going to talk about how to know if your family member is eligible for Medicare and Medicaid. Most people I've seen out in the industry, most people confuse the two, or don't know the differences between the two. They've heard Medicaid because we hear about it when we're talking about our children. We're talking about low income people who are unable to work or who don't have work, and then we hear Medicare, and it sounds the same, so we kind of use it interchangeably, but there are big differences between the two, and they can work hand in hand. So first, Medicare is actually our federal system of health insurance for people 65 and older, or for certain people under 65 who may have certain disabilities. Also, people who have end-stage renal disease, they're entitled to Medicare. So Medicare is our United States government federal insurance. They put that in place, the system in place, because they understand that when we are 62, we retire, typically and then by 65, we may or may not have, still have that health insurance that we may have had through our employer. So while we're working, the federal government takes those taxes out of our paycheck. Do you ever look at your check? You see the FICA, the Medicare, the things like that. So they take those taxes from our payroll for a minimum of 10 years, 40 quarters. It equals 10 years. And that pays for our health insurance when we are no longer working. So that's what Medicare is. And then the Medicaid is a state and federal funded health coverage program for certain people who require financial assistance for their health care. So we have young mothers who may need help with their child care, their child's health care, or their own, or people who are, again, on disability, who are unable to work and take care of their health care. Medicaid steps in and provides financial assistance. Now, if a person who has Medicare and they have limited income or resources, they can also be entitled to Medicaid along with their Medicare. And what the Medicaid does for them is it steps in and pays for those Medicare premiums. Medicare, we may know that it consists of two parts. It has Part A, Part B, which covers 80% of our hospital coverages, inpatient stay, the skilled nursing facility, the home health care. And then the Part B it helps our Medicare, our seniors pay for the doctor's visits, urgent care, lab tests, things like that. But that 80% leaves us with 20% having to pay out of pocket. So if you think about going to a hospital and you stay in a hospital your loved one stays in a hospital for a week, that hospital bill, Medicare will pay for 80% of it. That hospital bill could be, $50,000. And then we're stuck with that 20%. So Medicaid steps in and says, hey, if you have limited resource or income and you're not able to cover this, we'll step in and pay for those medical expenses.
Wow, that's big.
It is. So we call, for people who are spiritual, we call Medicare and Medicaid working together like the Father and the Son. Because
I love it. I love it.
It's true. Because
Yes.
that Medicare covers certain things, but if you're unable to fill in those gaps, that Medicaid steps in and it covers where you're missing. So it gives you that 100% coverage. So you can't go wrong with the Father and the Son working together.
Right.
So your coverages are taken care of, and they help pay for premiums. A lot of people who have Medicare, they know that there are still premiums associated with your Part B. You got the co-pays. So Medicaid steps in and fills in those gaps. There was something else. Oh, there was one thing I wanted to point out, because Medicaid, a person can access Medicaid along with their Medicare by applying online to gateway.gov or going into the local DFACS office. And Medicaid, the state, will look at a lot of different, what's the word I'm looking for? They'll look for like pieces to the puzzle. There are a lot of different, thing is moving a little bit. Let me try to fix it. Okay, there are a lot of different, what's the word I'm looking for? My mind just went blank. What is it? Factors. There we go. Factors that go along with determining if someone is eligible for that Medicaid. So that if a senior couple is married, they can apply for Medicaid separately. So regardless of their individual income or their combined incomes may be above the state guideline limits, but because they both have Medicare, the state of Georgia will allow them to apply separately. So they can be considered individual even though they are married. So that helps the household out. There are four different levels. Yes.
Do you know that income cap for married and separately?
Yes, for an individual, the monthly income is, again, there are different levels, but the max is $14.29 for an individual. So if an individual's income, their Social Security income, or if they're receiving retirement, but their combined income is $14.29, then they are entitled to some level of Medicaid. And what to do? It'll help pay for the Part B premium. And if their income falls below $14.29, they'll pay for co-pays. If it falls below $1,000, they'll pay for all of your co-pays. And they'll also allow extra services, extra money to pay for those things that Medicare and Medicaid leave out, like dental coverage and glasses and things like that. It provides more money for that based off of the income. So yeah, there are different levels to the Medicare savings program.
Now, what about as a couple? What is the income?
The max as a couple, you know what? Let me see. I got a little spreadsheet here. Hold on. Oh, and real quick, I heard you talking about those waiver programs for
Yes.
Medicaid. I'm excited about those too, about keeping our seniors in their home if they want to. So there are a lot of services coming up with that. But with couples,
So Payola said couples is $14.29.
Individual.
No, individual is $14.29. Payola.
Individual is $14.29, and couples it is $19.23.
$19.23.
So that
yeah, $19.23. Payola put $14.29 for individuals and $19.23 for couples for me,
yes.
please.
And now with the couples again, if only one of the couples has Medicare. So we have some family members, say a person is receiving Medicare because of a disability and their spouse is still working. They're not on Medicare yet. So they're looking at the household income. 1923 is for one spouse who has Medicare, the other one who's not. If both spouses have Medicare, then that means they're only going to look at one spouse's 1429 max and then the other 1429 max.
Okay, got you.
Does that make sense?
That makes sense.
Okay. Now we talk about if you qualify, how do I apply for it? How do I get those services? So most of our seniors, they already have Medicare because they get it automatically 3 or 4 months before they turn 65 or prior to their becoming disabled. If a person is a senior is 65 already and they haven't received their Medicare, you need to call Social Security immediately and to request it.
I don't mean to cut you off, but before I lose it.
Yes, please.
Is Medicare okay, so like you said, they are eligible for Medicare if they become disabled. Is that the same type of Medicare as if they were turning 65? Okay.
Same program, absolutely. Same program. It comes from the same Medicare bucket. If a person is under 65, they can get Medicare if they've received Social Security disability for 24 months or more, a minimum of 24 months. So I have individuals who are in their 20s or 30s, and they may or may not have contributed to the federal system, but their parents had. And that individual may have been born with sickle cell, or they have a disability that prevented them from working or prevents them from continuing to work. They are entitled to Medicare just like you are when you turn 65.
Oh, okay. Awesome.
Yeah. So applying for Medicaid, that's the fun part. Applying for Medicaid, a person has to have Medicare, at least Part B. That's important. You got to have at least Part B in order to be considered for that Medicaid program for Medicare for seniors. So you got to have Part B. Then you want to go online to gateway.gov, and they'll ask you questions to apply. Also, your local DFACS office. You go down to the local DFACS office, and they'll help you apply. Also, through Social Security. Social Security has a lot of resources for our seniors as well. So if you call Social Security and tell them, hey, I need help with my Medicare premiums, they will apply for the Medicaid program, savings program for you, and you'll receive the paperwork in the mail through Medicaid, and you'll have to complete it and send back what they're asking. So there are 3 different ways to see if you're eligible and qualify for Medicaid along with the Medicare.
Awesome. Great information, Samara.
Yeah.
Great information. So tell me a little bit about those new guidelines.
With well, as far as Medicaid goes, the guidelines are based off of income, and those limits change from year to year. So every year with the Medicaid limits, we want to check online to the Department of Human and Family Services and see what those limits are from year to year. Every March, we get new limits, new guidelines for those. Now, there were some new changes within Medicare eligibility for services in this year with 2020 for people who are on Medicare and have end-stage renal disease. So prior to this year, those individuals were able to get Medicare and Medicaid based off of their income, but Medicare was not allowing those individuals who had end-stage renal disease to access extra Medicaid benefits or extra Medicare benefits like dental, hearing, vision, gym services, things like that that come along with having Medicare and Medicaid. So that changed for this year. Anybody who is on dialysis or has end-stage renal disease are entitled to extra services effective 2020.
That's awesome.
Yeah, it is. It is.
Yeah, that's awesome because there's a lot of seniors that has renal failure
Right.
disease. So that's awesome. And
Right. So prior to this year, they would not have been able to access their Medicare money to pay for their dental work or glasses or even their transportation, even though that money is there for them simply because they had end-stage renal disease. Medicare, CMS didn't allow them to access those services, and that changed for this year. So that was a really great thing that happened for our beneficiaries.
yes, and tell them a little bit about because now you're able to work. Now you're able to offer Medicare benefits based off offer Medicare benefits that are specialized, if I'm saying this correctly, that caters to the individual specialized care need.
Yes.
So
Yes.
talk a little bit about that, and then we're gonna go. But talk a little bit about that. How you can offer them the best plan for the senior based off their diagnosis, care needs,
Yeah.
whatever it might be.
Yeah. So with seniors who already have Medicare, if you have Medicare, you have to have Part A and Part B in order to take advantage of what I'm about to share. But if an individual has Medicare Part A and Part B, there are services that they're entitled to that they have already paid for. They just don't know it. They've already paid for services that are administered through, that are provided through Medicare Advantage plans, supplemental plans, things that Medicare, traditional, original Medicare leaves out altogether. CMS says, hey, we've taken your Medicare, your taxes for the minimum of 10 years. And when you turn 65 or you become disabled, we'll provide coverage for 80% of those expenses, the hospital and the doctor. But that's it. They don't cover your medications. They don't provide any service like we talked about, the dental, hearing, vision. We call those ancillary benefits. Medicare simply pays for 80% of your hospital visits, inpatient, and then doctor services. So with the person who has A and B, they are able to tap into extra services to fill in all those gaps that Medicare leaves out. So aside from Medicaid, there are still services available to help alleviate that 20% that Medicare doesn't pay, that helps provide the coverages, that does provide coverage that Medicare leaves out altogether. Again, eye care, dental care, hearing aid, transportation, other ancillary benefits. And then it helps to offset that 20% by leaving the members with just a set black and white copay. So instead of being responsible for 20%, like we mentioned earlier with that hospital bill, you have no idea what 20% is going to be because it's 20% of X, whatever the services are. Well, there are plans available for people who have A and B that allows them to know exactly what their out-of-pocket expense is going to be, regardless of what happens. So if you go to the hospital and you're admitted, they keep you for a week or a month, you know, with these extra services that no matter what Medicare does or doesn't do, my out-of-pocket expense is only going to be, or it's going to be a set dollar amount. You'll see, you know exactly what it is before you walk in the door. So there are no surprises afterwards. And a lot of people just don't know that you have money available that's sitting there to fill in the gaps for now.
Wow.
And that's what I'm here for. So
Right.
when caregivers call and we do our consultation, I'm able to help guide them. I'm able to ask questions to help hear what you need specifically to find those gaps and to fill them for you.
That's right. That's
So
right.
I appreciate you for reminding me about that. I'm all about educating, but I forget that there.
Educating.
Yeah, absolutely. So if you guys have any questions with the consultation, please give me a call, and I look for ways to help fill in where you're missing,
That's right.
and to help save money. Period. Point blank. Period.
Yes.
Because when we talk about limited resources or income, all of our income is limited. It's really limited, and my job is to help keep as much of that money in your pocket, because
Especially
we've
for our
already,
seniors.
especially
Because they
especially
are on, a lot of
for
people don't
our
realize,
seniors.
I've learned a lot. They are on a limited income. Do you hear me? A
Yes,
lot of them
I
are on
see it
limited
every day.
income. They barely have
I
money to
see
go
it.
to the grocery store and buy money. Some of them are going to the food bank, okay?
Exactly,
So,
exactly. That's
you,
where I meet a lot of my customers, because there are resources out here, but people don't know about them. So I go to places where do you need? What do you need? Where people who are looking for help, what do you need? Because there are resources out here. They are out there. A lot of people just don't know where to go, where to look for them. So here we are. That's what we're doing today, educating it. Guys have questions, please. Even if I like to call myself the people's agent, because
yes,
a lot of times we don't know what questions we should be asking. You're not an insurance agent. You don't know what you don't know. So as the people's agent, I try to not try to I tell my customers, I listen for what they're lacking, and I make sure I tell them everything possible that could help them, so they can gather the fruits that they need to fill their cups. So I look for needs. I look for missing gaps so that I can help specifically. So
and that's why I
so
love you, because you
that's what
have
I'm
a
here
heart to
for.
serve. That's why I
I
love
do.
you, because you have the same heart that I have, and it's a heart to serve. It's not all about the money. You really care about our seniors, and you really care about making sure that they have what they need, and educating them and giving them the best plan when it comes to Medicare.
Definitely.
And that's your expertise. So we're
Definitely.
very happy to have you on this evening. Thank you for taking the time out, because I know you're super busy, but thank you for taking
Yeah.
the time out to share this valuable information. Please let everyone know how they can contact you. We're not trying to sell you all or anything. We just want to educate, get, and
Yeah.
give you resources. And as I stated, she does offer free consultations for those questions, additional questions you might have. How can they contact you, Samaria?
Well, directly, my cell phone number my is 404-957-7057. I prefer calling me directly. Or you can send me an email, first name, last name, Samira Carr, LLC @gmail.com. That's SAMEERAH Carr, CARR, LLC @gmail.com. And I'm here to answer any questions, anything about, honestly, anything about insurance, whether it's Medicare, whether it's life insurance, whether it's anything dealing with insurance. I've been an agent for about 17 years, and I believe the more we know, the more we can help, the more we can share. So any questions, please don't hesitate to reach out to me, to call my cell phone, to send me a text message. We all have lives. Send me a quick text message. Hey, I saw you on Rebecca's live. I had a question about this. Don't hesitate to call, to text, shoot me an email. I'm all about helping.
Yes. All right, all right. So you have it. Thank you
Yes.
again. Hello, good evening, everyone. You all have a blessed evening,
Yes.
and
Yes.
we'll be coming back to you soon with additional information. I'm having so many people reach out to me,
Yeah.
experts reach out to me who's wanting to
Oh,
come on the live and
yeah.
share. So I'm
Yeah.
so excited about that. Thank you again, and you all have a blessed evening.
Goodbye.
Bye.